Yeah, welcoming a group from Royal Victoria Regional Health Center. And so the first question you might, somebody, whoever would like to speak up, give us a sense for your hospital, so that's
Sure.
Sure.
I'll take
Sure.
this. So RVH is a 460-bed regional health center. We provide regional services for cardiac, renal, cancer. Approximately 500,000 patient visits per year, 90,000 emerge visits per year. Kind of the largest hospital kind of between Toronto and into the north of Ontario. So we service a very large community, big geographic footprint.
great. What was your most recent Nexal implementation?
So we're currently going through an integration right now. The one that we finished last year was an integration between Hypercare, which is a clinical communications application, and Hillrom or Baxter our nurse call system. So this is whenever a code blue or code pink button is pushed in the building, it automatically forwards to our Hillrom panel, but it also simultaneously through Connexall integrates with our Hypercare application. So the code team, and it's a predetermined code team based on schedules, they'll get an automatic notification on their phone with the location, so they can respond to code blue. So we've seen certainly a decrease in response times, which is fantastic. In a medical emergency, like seconds count. So being able to reduce that, before we even get a chance to go overhead with the location, the clinical team, be it physicians, RNs, RTs, they're already on the way.
Well, so the objectives you set out for up front, have you feel they've been
Yeah. A lot of it was, going to obviously, improve patient outcomes. It's paramount.
Mm-hmm.
But it was also to decommission our internal paging system. Our external pagers, we decommissioned those about 2.5 years ago, and we decommissioned our internal paging system last summer. So yeah, really excited about it.
Sorry, Diane, just quick jump in.
Yeah.
What is Hypercare?
Oh, okay. So Hypercare it's a Canadian-based company based out of Toronto. They're basically an on-call scheduling, clinical communication. So all the resource nurses in our building have Hypercare phones, and they can connect directly with physicians.
Oh, okay, so it's like the communication
Yeah,
tool.
consider it like a secure WhatsApp or iMessage, but it's really focused on clinical communication.
Got
It is compliant with all privacy legislation in Canada and the US, and it connects providers together to improve patient outcomes.
So similar to Volt or Vocera or Epic Rover or any of those.
Yep,
Okay.
exactly.
Learn
It's
something.
a Canadian version.
Yeah,
Secure
cool.
messaging.
Well done.
We utilize it for a lot of code STEMIs, code
Yeah.
alerts.
It's really good, not only within the hospital context, but activating clinical response teams from outside the hospital. So, or if you want to talk about STEMI, and that was our first.
It was our code STEMI. It will alert whoever's on the code STEMI team. They call into our locating, and the alert gets sent out. The team's prepared, ready to be there, and they're there within 30 minutes. So it's they can respond. They know they're all on their way. Send the 12 ECGs via the Hypercare system. So yeah.
Cool.
Thank you.
And so you guys have Philips patient monitors and then oximeters.
Yep.
Is that and
Yes.
we're interested in workflows, and that's I don't know if it's something you brought along, or maybe you'd be able to send to us.
Yeah. Sure. So I was looking. We for our. I'll send it to you.
Yeah. Okay.
We'll find it. We just didn't have time to.
That's not a problem.
Pull
That's
them
awesome.
together.
Like we're kind of gathering things to help the product team help them.
So are you looking for from our this like the Philips cardiac monitoring system through the and the telemetry system?
Yeah,
and the oximetry.
Through the secondary notification.
Yes.
Is
Basically.
it more like the information that you're looking for? Is it the clinical workflow, the workflow that our team, the clinical team on the unit is applying, or the background technical stuff that is happening for the messaging between the two systems.
The clinical workflow. So,
Yeah.
like, the escalations for the alarms,
Right.
which alarms you're sending,
Yep.
how quickly you're sending them, which you're suppressing, which you're, not sending at all. Those kinds. Like, usually it comes on a kind of a spreadsheet.
Yeah, okay, that's good. We
Asystole,
do,
blah, blah, blah.
yeah.
Right to,
Yeah, we have that. Yeah. And when we first, implemented Connexall and those workflows, that was back in 2012.
So they probably have changed since then.
Yeah, so I have the older ones, the older versions. So yeah,
I have the
we'll
latest
look
testing
together.
The
and
latest
send
ones,
those.
yeah.
Yeah.
And the response, like the clinicians, like, are they expressing alarm fatigue?
Yes.
This is improving. It's not.
So
Yeah.
want me to speak to that?
Yeah.
Yeah, the team's alarm fatigue is something they experience, but we have really, when we first implemented, made a lot of changes with the alarm. So obviously, no green alarms, very few yellow alarms will come through, and all of the red alarms, to devices, which I know Sue can speak to that, to the nurses' devices. We were having an issue with the nurses not carrying their phones because they were having issues with some of the batteries, or just felt like
It's because of alarm fatigue.
it is.
They
Yes.
just use
And
those things for excuses.
and
Yeah.
before coming here, went out and
Yeah.
actually had a good conversation with our cardiac nurses and talked about that. And they're like, we're in rooms, it's going off constantly. We have a central monitoring station which identifies the alarms. So there's typically always somebody at the desk as well. So we do have a secondary set of alarms. So they have their primary nurse, the secondary nurse, the charge nurse can get all of the alarms as well. But there's a lot of alarms coming to their phones. Call bells used to come to the phones as well. So it was a lot of alarm fatigue.
Interesting.
For sure.
So do you have an alarm fatigue committee or is it just you working with clinicians to try and figure things out?
Yeah, we don't have an alarm fatigue committee. That's a good thought. But we have discussion about it, definitely. And if we just recently changed our alarms because they were using their phones. Like, we were finding that
It's a huge
staff
issue
weren't carrying
everywhere.
their
Yeah,
phones,
and
not doing
that
their
reminds me of the survey too.
Yeah.
Yeah, there's a
Mhm.
follow-up question. Jan, our clinical lead, they have a survey that we can implement for the bedside clinicians that we're happy to do on your behalf and then share results with you.
Sure, yeah, I think that would be
Okay.
excellent.
Awesome.
Yeah.
That's great.
And we only had, when we first started this, the cardiac renal floor was doing the telemetry, but now we have another floor doing oximetry. And they're also, during COVID, we implemented telemetry on that unit. If somebody had COVID and needed telemetry monitoring, they would go there. So there's, those two units doing that telemetry, working together.
And just to be clear, when you say you have centralized monitoring, you mean on the unit, like it's
Yes.
there's the stations at the nursing
Yeah.
station, not like you have a
No.
room that monitors the whole hospital.
No,
Okay,
not at all.
yeah.
It's just on the unit. Mhm. We don't do the telemetry monitor person. I know
Yeah.
in the States that is a thing. But
So another thing we saw in looking at the records we have for you, and I'm very new, so I'm like,
Yeah, that's okay.
Benetech Code White / duress alarms from Bill Centrac. How is that working?
So this is a project we're currently working on with Connexall as the middleware, as well as our new security vendor. Our hospital is going through a significant security architecture modernization, essentially a rip and replace of our security infrastructure, access control, CCTV, the underlying backbone of those systems. And with the new system, we wanted to see if there was a way to integrate kind of what's happening on the clinical units from the nurse call system into our security system. So we're currently kind of in the final programming phase, for lack of a better term. And essentially, what it'll mean is, large hospitals, we'll have 500-600 individual cameras throughout the hospital. So it's impossible to have all 500-600 screens up in the security office, for example. So with the new system and this integration, once a static code white button or a mobile duress button that staff wear goes off, all the cameras in that area will automatically come up in the security office to give my security team a bit of situational awareness before they respond to the code. They just to give them a sense of what they're getting themselves into and how to prepare, and that way they can develop a plan on the way. My role, I'm not clinical, so my role at the hospital in terms of security and emergency management and switchboard operations is really to understand, are there other opportunities to integrate with non-traditional or at least non-clinical systems to improve patient outcomes and improve staff safety.
Sorry.
Yeah, go ahead.
So you're using Connexall to connect to the building systems with the cameras, and once it senses the code, it pulls up those feeds automatically. Like that's Connexall doing that?
Yeah. So let's
Sure. So we are receiving the location ID information and the code information directly from the alarm systems.
Right.
So we have static buttons installed all over the hospital, and we have these Centrac badges that our staff members carry. They have a address button on it. The location information is stored in the Hillrom side. They have a database, and Connexall is basically the middleware that is transmitting that message with the location information and the details of the alert, like let's say code white, to our security system with the BACnet ID included in it. So there's a mapping between the security system and the Hillrom database that will be handled by Connexall. So if let's say
And Centrac as well?
Centrac is our hardware vendor, but
Yeah.
the actual application is Hillrom /.
Oh, okay. So Centrac's integrated to Hillrom, and
So
then Connexall pulls it from
Yeah,
there.
the badges that our staff members carry and the virtual walls and the room monitors that are installed throughout the hospital are Centrac branded, but they talk to our Hillrom nurse call / connected care system.
Cool. So all your nurses carry a badge?
With this address button on it. So depending on, when they press the button, where they're standing, that information is also sent. So if they're inside the room, let's say patient room 19 versus the hallway, that information is being captured by the Centrac hardware that is ceiling mounted, and through Hillrom system sent to Connexall. Connexall will have a mapping database between the BACnet ID and the location, and will trigger that specific BACnet ID to Genetec, which is our security vendor, and we'll use that ID to bring up the security.
Got it. Do you use the RTLS badges
We do.
for anything else?
We do it for
Like
automatic rounding.
Patients in the room. Oh, there you go. Okay. Do you sort of alert the patients like who's in the room kind of thing, or it's just for your own system?
It's
when the nurse
mostly
is
for
there?
the nursing staff, and again, maybe you can talk to it if I'm wrong on this, but it's mostly for the nursing staff. They have a status board that is like a big TV up on the unit that is displaying which staff or which nursing team member is in which room, or if the nursing station, or if it's at the hallway, and there's a light that comes outside the room and the rounding is due. So
And that's specifically Hillrom, though? There's no Connexall involved in that portion?
no, not in that portion.
Yeah. Cool. Thanks.
That's good. That's good.
So many questions.
Yeah. How are you using SSRS reporting? How effective are the templates and suggestions for improvement?
So is that the
I can answer.
yeah, okay.
Honestly, we don't utilize the Connexall reporting.
Okay.
Any reportings that we used to run or we still run is from the Hillrom side, and that's mostly contact tracing for things like COVID-19 or like roundings, reports on the rounding. The only time we use the Connexall reporting if there's an issue reported to IT, which is, oh, so-and-so alert was triggered, but it never got to the phones. Can you find out what happened? So we go trace the call point activity history, which path it followed, and where it failed. That's the only use case we have been using it so far.
Where I see, and when we first initiated Connexall way back when, we were looking and we would run reports. And one of my moments were remembering sitting with Steve before we had virtual and trying to figure out like what reports we wanted to pull and run. And they were so extensive on nurse call, like how long it takes to acknowledge the alarms. At the time, we were using it for call bells as well. So utilizing it to see like response times for acknowledgement of alarms, that's where I could see from a practice standpoint and management where the reports were coming.
And when you're trying to deal with alarm fatigue, right? You
Right,
can see,
yeah.
you can, depending on the reports, you can use them to kind of determine which alarms are being sent, which alarms aren't being answered because they get escalated to the third level, stuff like that. And you can use it you could theoretically use them to refine your alarm management practice.
How long are we taking to respond
Exactly.
to an escalated alarm?
Yeah.
That's true.
But they're not necessarily intuitive to use. You kind of have to have the question ahead of time when you go in. But sorry, that's just another.
It's okay.
Yeah, I mean, we do use ConnectCell reporting also for monitoring the health of our duress badges. So
For batteries and stuff?
Yeah, for batteries.
Okay.
There's a shelf life on batteries; they only last so long. So we needed to find a way to bring basically 3 data sets together. There's the health of the batteries, who they're assigned to, and basically create a report with our HR database so we can escalate to leaders to say, okay, these X amount of nurses on your unit, their batteries have 30 days left of battery life or 90 days left of battery life, or they're not working right now, so they need to get a new battery. So we use a ConnectCell report from the Pulse dashboard to pull that information and to basically create a custom built report that we developed in-house to share with leaders just to maintain kind of the health of the system.
You don't use alerts though, like battery low alerts. You don't generate those. You just basically generate reports and then they just
Bi-weekly reports to the leaders and they follow up with the staff.
I guess the main reason we're not using the alerts that you just spoke about is because the Centrac system doesn't talk to our internal system. So it's a separate dashboard that our staff is using to monitor the battery health. And then we pull some data out of ConnectCell on which badge is assigned to which individual.
I see.
We pull them together. We use our HR database to kind of get their first last name information,
Gotcha.
who they report to, all those 3 reports into one single sheet. That's what our team is using.
Oh, that's very ingenious, actually.
It was something
First I've heard of that.
Yeah, it was something I talked to Sandy about. We were at a conference together,
Hypercare.
Hypercare in May, and it was something, hoping it we put on your product roadmap for the coming future. It's something that we have to develop in house. But if there's something that you can do on your end in terms of a report that shows whose badge it is, because right now it's digital device ID, it doesn't show an assignment. So.
Right. Okay.
So that's where we're using ConnectCell. So the badge ID portal is the Centrac portal. It does not communicate with our internal system. So we use the badge ID from the Centrac portal. We use the username and their same badge ID from the ConnectCell portal, and then associate that using a first and last name and their direct report manager from our HR systems to kind of put all the data into one single sheet.
Okay. Cool.
So next question, tell us about your experience with Cisco and SpectraLink devices for secondary alarm management.
I can answer that.
Okay.
Yeah, honestly, it has been spectacular. Like, we used to be primarily a SpectraLink shop, but over the last couple of years, we went through a phone system refresh where we purchased a whole bunch of Cisco phones, and working with ConnectCell, getting them working has been flawless. That's all.
And you run the Hypercare on the Cisco phones?
No.
Oh.
They're iPhone and Android based apps, mostly iPhones in-house.
So what do you use the Cisco phones for?
For nurse call alerts, the Philips alarms that they also get delivered to those through the XML.
Oh, so you don't deliver them through Hypercare? Hypercare is just a messaging?
Hypercare is used primarily for messaging and specifically for code blue automation.
Okay. So do you use Mobile Connects on your
We
SpectraLink?
don't. It is something we looked into.
So how do you get the messages then? The alerts?
On the Cisco phones?
Yeah.
Using the XML clients.
Okay. I don't know what that is.
We
but-
use, they use the mobile, the nurses carry their mobile device. You're talking, I know that, behind the scenes, but I know the nurses carry their SpectraLink phones and they get their alerts to their phones.
And so how does it show up on the phone?
As a pop-up notification.
Oh, just like a text saying.
Yeah, so like let's say room 9, bed 1, call exit, or
Okay, and then how do they interact with it, or is it just like a
there's
one-way?
multiple options. They can ignore it or they can acknowledge it. So depending on which button they push, it gets logged into the ConnectCell database
I see.
or the ConnectCell reports that it was either acknowledged or ignored by this specific extension assigned to this person.
And if they don't do anything and they don't cancel it, then it'll just escalate.
It will, depending on the alarm type. Some alarms escalate to charge nurse. Some alarms just repeat themselves after. Certain
Or a secondary nurse, if the secondary nurse is signed in
And has the
and
battery
told
working.
us- Yeah, and is carrying their phone.
Okay. And tell us about your Siemens fire panel integration. Is that effective?
we don't have.
Don't have one. Okay, might have been something early on.
We have been a legacy thing that we
Okay.
decommissioned.
Makes sense.
In the last five years, I've been working with RBH. I have it still.
Okay, cool. So last question for each of you. From your perspective, what's the greatest benefit of ConnectSol to your house business?
From my personal perspective, it's the alert delivery and just the flexibility that we have with ConnectSol with multiple different system integrations and the kind of support that we get from. Every time we reach out to support, it's fairly instant that we get a response, and that's my, again, from IT perspective, that's my personal win for having ConnectSol.
From a clinical perspective, from the nursing perspective, it is the alerts, the being able to in real time see what their patient is doing, what the monitor is showing, and being able to act on that. And the support from ConnectSol is always fantastic.
From my perspective, it's getting the right care to the right place at the right time. So it's those quick responses, especially our integration with hypercare, reducing our response times for code blues when seconds matter has been a huge win for the health center. Something that we're very, very proud of. So those are the
That's good. Very good.
Awesome.
Yeah, awesome.
It'd be nice to follow up with you. I'd be interested to see some screenshots of
For sure.
the way your alarms come to the phones and
Yeah.
stuff. Is it always the same sound, or they have different sounds?
No, we have different sounds depending on what type of alarm it is.
Okay. Whether it's red or yellow
Red,
or green.
yellow, green. Again,
Yeah.
a call bell is usually a different sound
Right.
on the phone
Okay.
versus a DSAT or like
Yeah.
an extra critical alarm from Philips side that is supposed to be a different sound.
Cool. So if the best way to get the workflows would be to our email, and send it via the WorldConnex text.
Okay.
And then,
Get those.
really appreciate it.
Yeah, that'd
Yeah.
be great.
And also we'll follow up with you on the survey or Jan
Yeah,
or someone.
yeah.
Okay.
We'll communicate that to James.
Perfect.
Yeah.
Yeah.
Okay.
I
That's
do have-
excellent.
I'm sorry, I do have a question. I don't know if this is an appropriate time or
Sure.
the right team to ask this. In one of the presentations, they mentioned how their ConnectSol system is integrated to their EHR
Yeah.
for assignments.
Yes, of course. Yeah.
Is that an option, or is that an opportunity to integrate ConnectSol with Meditech Expense? Of
course, yeah.
So, because that's
Meditech
one of the things that we really struggle with.
Sorry,
right?
Meditech Expense?
Expands.
Expanse. Oh, yeah,
It's
yeah,
just
yeah.
another, right, yeah.
Another
Yeah, totally.
version of it.
Yeah.
Yeah.
Because that's one of the things our team is struggling with, that making those assignments and remembering to log out at the end of the day, so proper alerts are getting delivered right on time.
Use it. Well, yeah, and you could use ConnectSol can push those assignments. You could make them in ConnectSol too and have it timed out so that they just go off. Anyway, I would talk to the team in the Innovation Center.
Okay.
Just ask them the question, like Tim or someone like that,
Okay.
Jason.
Absolutely.
And any questions you have like that.
Because that
Definitely.
just came up in our last.
Yeah,
in
that is
that
one
round
of
with
the.
those. Mhm.
That is only one of the things that our team is struggling at the moment.
Okay.
It's just that assignment piece and removing assignments at the end of the day. Because what happens is they leave their assignments
Yeah,
up,
I know. I've seen it.
and
Yeah.
it causes a delay in the alert delivery time. Right?
Yeah.
Yeah.
Because it's trying to reach those phones first before it goes to the next one. So,
Yeah.
Yeah,
Okay.
Innovation Center. Yeah, definitely. Yeah.
And last question,
Yeah.
are you guys okay if we use any of this for promotional stuff as long as we let you know ahead of time?
Absolutely.
Okay, cool. Thanks.